So I think we can start. Colleagues, friends, ladies and gentlemen, good evening, good afternoon, wherever you are tuning from. Welcome to this exciting session. My name is Martin Mushangi, working for Amref Health Africa. So today we do have a very exciting session, and our session is entitled the role of WASH in fostering women's economic empowerment and improving sexual and reproductive health. So to kick you off, I just want to point a few things. Managing waste, our own waste, whether it is fecal matter or waste emanating from solid waste or any other human activity, is a major challenge, especially here in Africa and many other parts of the world. In Uganda, for example, 21% of people practice open defecation. And this situation is not different in Kenya, Tanzania, Ethiopia, name it, in sub-Saharan Africa. So what we know is that poor sanitation contributes to about 10% of global burden of diseases, especially due to diarrhea diseases. Other evidence shows that diarrhea alone kills about 1 million children, and this is more than HIV, AIDS, TB, and malaria combined. I repeat again, more than HIV, TB, and malaria combined. Now, unfortunately, we all know that women suffer the most. And this is because women are exposed to indignities that are brought about due to lack of privacy. They lose a lot of time. They are exposed to gender-based violence, and especially when they try to go for open defecation, and when they also try to go searching for water to provide for their families. Now, the good news is that if we improve access to water and sanitation services, we expect major ripple effects. And these major ripple effects impact directly and in a very good way to women's health, the food and nutrition, education. Our girls are more able to access schools and be able to find time to attend to their classes. It saves on their time. More importantly, there is a whole picture about the economic empowerment. And lastly, if you look at it from the shifting of the gender roles and norms. The good news is that, again, I do have a panel here of experts. The experts have been involved globally in addressing various barriers that make access to sanitation a big issue globally. And so, the other good news is that we do have people here who have invented novel ideas, such as Finish, a PPP model that brings together the government, the private sector actors, and the communities to sustainably access sanitation to the rural and the marginalized people. So ladies and gentlemen, without much ado, I want to introduce my panel. And beginning with Engineer Mutuli James. Engineer Mutuli James is our program lead for water sanitation and hygiene in Tanzania. Engineer holds a BSc in engineering and he has a master's degree in environmental sciences. And also want to introduce Hajra Mukasa. All of us will have a chance of interacting with each of them one by one when we start to listen to them. Hajra Mukasa is a public health specialist. She is our lead for WASH in Uganda. She owns a degree in environmental health from Makerere University and a master's degree from the same. Hajra is more interested in seeing how best to utilize the digital space, the digital solutions in ensuring that people the marginalized people have access to improved sanitation and hygiene services. I also want to introduce to you Valentin Post. Valentin Post is from Holland, a friend, a colleague, a mentor of many of us. He works for a company called Waste, and he has been involved in starting up many models, ideas, including the Finnish model, which I spoke about. I want to talk about Unia Musasi. She is the executive director of Uganda Water and Sanitation Network, which is an agglomeration of 200 civil society organizations. So Unia brings together a very huge network of civil societies, all of them geared towards addressing SDG number 6. She is a strategic leader, and I believe what she would want to see is all of us joining hands with her to ensure that we all attain SDG 6 by the year 2030. I want to introduce Dr. Harind Massa. Dr. Harind is the Director for Environmental Health and Sanitation in Tanzania. He is more or less involved in ensuring that access to sanitation happens, including everyone, those who are elderly, ensuring that the gender disparities which we normally face are addressed. Dr. Harind is a board member of Finnish Mondial in Tanzania. So he is involved in giving strategic direction about Finnish and how to scale up the processes they are in. Lastly, I will speak to Professor Miriam Sindibe. Professor Miriam Sindibe is a friend, a mentor, and a person who has contributed seriously to the global momentum, especially on hand washing. She is the founder of the Brands on a Mission, which aims at impacting health by bringing various models into one basket and spinning them all of them together in a manner that they can address the challenges, the public health challenges that we face globally. Now, allow me now to start diving into the panel discussion. And I'll begin by calling upon Hanjra Mukasa. So Hanjra, please tell us, please comment about the role of WASH in achieving universal health coverage in Africa. Welcome, Hanjra.
Thank you very much, Martin. A very good afternoon, a very good evening, a very good morning to everyone that is tuned in at this time. Universal health coverage, in my opinion, is everyone having access to the basic needed quality health services at all times. But like you said in your introduction, women and girls are disproportionately affected by the lack of access to water, sanitation, and hygiene, as well as sexual and reproductive health services. And this is mostly because women have been socially disempowered to lack resources and the power to decide or determine when and how they get what they need, including health needs. For instance, if in some parts of Africa, women are still spending up to 4 hours of their day fetching water for their families, it's no wonder that there is still time poverty amongst women and financial barriers to health services. In addition, up to 28% of girls will still lose up to 1 week of class time when they're in their menstruation period, just because they lack the basic access to menstrual hygiene management services, which greatly still contributes to the lower literacy rates we see amongst women compared to their male counterparts, and the consequences of lack of access to health information that they need. So looking at how the barriers to accessing WASH are linked to those of accessing health services, and looking at the role WASH has to play in the attainment of the other SDGs, I am not far from the truth when I conclude that WASH could be that single pivot that we need to achieve universal health coverage, especially when used as a tool for women empowerment. Thank you.
Wow, thank you so much, Hanjra. I would just want to follow up that with asking you another question. So what innovative approaches have you undertaken in your professional career to create sustainable access to wash and sexual reproductive health services.
Thank you very much, Martin. I'll still ride on the challenge that you stated in your introduction, the challenge of solid and fecal sludge management amongst most towns in Africa. AMREF created waste management social enterprises through the provision of proper approaches that convert waste to wealth, leaving no waste to waste. The conversion of solid and fecal waste into charcoal briquettes, compost, plastic tiles, and reusable plastic increased monthly revenue collection by 150% amongst women entrepreneurial groups and created jobs for over 600 youth and 700 women in Tanzania and Uganda. To date, these women and youth are now able to save and borrow money from their own saving groups and mitigate financial risks, which enable them to access sexual reproductive health and rights services. Another example that I quickly think about is what we did with women saving groups. Despite the social disempowerment, women have a very good saving culture. I think we all grew up seeing this. Now, riding on this culture that we see in women, AMREF transformed existing saving groups of rural women in northern Uganda into integrated education for WASH, sexual reproductive health, and rights services. Now, we guided these women to save for a purpose, and the purpose was access to WASH and SRH services. After a period of just 2 years working with women who do not even wear shoes when they come for meetings, these women have so far saved over $10,000 to facilitate access to WASH and SRH services. And our discovery is that water is this felt need that all these women agree upon and are willing to save for. So it's the drive. Unfortunately, the water points are still far from these women groups. And during a recent visit in northern Uganda, I met with a mother of twins who had 2 babies at a water point and was grappling with how to carry her babies and the jerrycan of water that she had taken to the source to go back home. So we still have a lot to do in that line. Another example is what we discovered in 2016. Deliveries under skilled care and ANC for attendancy were very low in the district of Amuro in northern Uganda. And the quick assessment revealed that the poor sanitation and hygiene condition in these healthcare facilities was one of the main causes of this low uptake. So AMREF provided running water in these healthcare facilities. We made some renovations. We provided mothers with bathrooms to bathe after delivery and constructed for them drainable latrines to access basic sanitation facility while at the facility. Interestingly, just 4 years down the road, we've seen over 59% increase in deliveries under skilled care. We see 78% increase in ANC for attendance and a 17% reduction in diarrhea incidences across these healthcare facilities, still emphasizing the role WASH has to play in accessing reproductive health services. Last but not least, I'll speak to the girls that you mentioned at the beginning. Riding on the JSK contribution that resulted into the approval of using participatory hygiene and sanitation education in schools in Uganda, an approach that fosters holistic knowledge of WASH and menstrual hygiene management by AMREF and other partners like UNICEF, World Vision, WaterAid, Red Cross, to mention but a few. Adolescent girls and boys have been trained to make their own reusable sanitary pads. This has resulted in improved attendance and retention of girls in schools by promoting views of menstruation as a positive and healthy part of adolescent growth and development. The sad part is that with all this training, if there is no washing space and changing room for these girls during their menstruation period, the training is still futile. So still goes back to the role that water has to play in making sure that girls stay in school. So ladies and gentlemen that are tuned in and everyone listening in, please join me in fostering WASH as that potential pivot to achieving universal health coverage. I thank you.
Excellent, excellent, and very exciting, Hajra. One key thing which I picked from you is a hashtag, leaving no waste to waste. You said very clearly that waste can be transformed into some money, and that directly can impact directly to, enabling women to access sexual and reproductive health services. Now, I want to move forward and invite Engineer James Muturi. And Engineer, what I wanted to hear from you is what has AMREF done what are the citable examples of WASH, women empowerment best practices, which integrates WASH and sexual and reproductive health services, and that can be scaled, and how can we foster the financial inclusion models in a manner that we are leaving no one behind. Engineer?
Thank you, Martin, and thank you, colleague, and all the participants to these sessions. Happy to share with you some. Happy to share with you some examples that AMREF Health Africa Tanzania has done in recognition of the WASH role to women empowerment and the best practice that can be scaled up. I will talk on two examples. One will be citing exactly on the WASH sanitation part, the empowerment of women through sanitation improvement, but also how WASH has been done in the healthcare facilities to improve the delivery services. I'm reflecting back from the Dublin Principle, 1992, where women plays a significant role in service management, but also the Dublin Principle number 4 recognized that WASH should be treated as economic good. So the two principles has been a pivot role in development of the WASH and the management of the WASH services. But also in 2010, the UN resolution recognized that WASH is a human right. And also the resolution called for financial resources, capacity building, and the transfer of technologies to ensure sustainable services for WASH. So there are a number of facts that AMREF has been going through and recognizing the women positions and the empowerment necessities to ensure that women are playing a pivot role to ensure that the WASH services and the sustainability of WASH facilities are enhanced. One, women empowerment is central for realizing what women's rights and the gender equity, as already been spoken by my colleague, but also empowerment women in economy and the closing gender gap in the world of work are key to achieve the 2030 Sustainable Development Goals. As you know, the WASH is playing a significant number of impacts to goal number 1, poverty, to goal number 2, food security, goal number 3, health insurance, goal number 5, gender issues, goal number 6, age safe, goal number 8, employment, and also goal number 10, issue around the equity. So straight away to the example is that in Tanzania, we have made a number of sanitation businesses through women and youth. The target of women is that we wanted to make sure that these women are associated in labor associated activities. As you know, most of women in our African country, they don't have this paid activities, paid labor engagements. But also we wanted to reduce time availability for economy activities for women so that they can also be in the position of decision-making processes. We also very keen to ensure that women support needed to carry out WASH economic activities, as we said in the Dublin Principles, and also the opportunities that can be created by women at a household level, but also at a community level. So we thought there is a lot of opportunity in WASH, as said by our colleague from Uganda, that we don't want waste to remain as waste, but we want to take waste as an opportunity. So there are a number of opportunities that have been brought to the WASH sector in Tanzania, where women have been able to make briquettes, they have been able to make some decorations, they have been able to make some compost manures and biogases out of the waste, out of the sanitation. In Dar es Salaam, we have supported a number of women groups, about 4 women groups, to do the briquette making and the businesses. So AMREF has supported them with the equipment, has supported them with the skills, has supported them with the technology. the women has been able to organize themselves and to raise their voices, well from at the family level, but also at the community level. A quick impact indicators that have been realized from this women intervention group empowerment process is that they have increased their income, paid income, by almost 8% from the beginning of the project and at the end of the project. But also the employment, direct employment of these women, they have increased the employment ratio at 150%. A lot of women have been stayed at home, doing some home activities, and now they were able to be employed. But the voice, the decision-making process, this through their groups have been now engaged in different decision-making process, well from the village, from the streets, from the ward, and from the district level. We have evidence the number of meetings has been now recognized the women groups through the sanitation groups. They have been invited for the discussion, and they have made their voices have been heard across the community. We also are piloting and initiating a number of other fecal sludge circular economy initiatives where women will be engaged in this fecal sludge empty and linking biogas units to the household level, so that this can be also a kind of direct support of women at the household level. The other example that I would like to share with you this afternoon is that the role of WASH in fostering sexual reproduction health. I'm calling back how the adequate water, sanitation, and hygiene are essential components for providing basic health services. WASH in healthcare services has been proven to prevent infection and the spread of diseases, protect staff and patients, and uphold the dignity of vulnerable population, including pregnant women and disabled peoples. So AMREF has been working with a number of healthy players across the country, and we have been focusing straight away to ensure that the integration of WASH and health are at par, at 100%. We also know that the health facility acquired infection and antimicrobial resistance have highlighted the consequences of lack of water and sanitation. Lack of access to water and sanitation in healthcare facilities discourages women from giving birth, and the facilities are or cause delay in care seeking. Therefore, AMREF WASH Africa Tanzania has been in a helping end to ensure that WASH services are provided in our healthcare facilities. So I take a direct example of our project that has been done in collaboratively with the other players across the country, supported by Canada. It's called Canada Africa Initiative to Address Maternal, Newborn, and Childhood Maternity in Tanzania. So we intervened in 12 facilities, healthcare facilities, with water, sanitation, and hygiene. The project was straight away linked with the community health workers and the community sanitation teams, so that this team of people, this kind of health facilities, health cares, are linked and counseling the community even before coming to the healthcare facilities. So in a quick result, it was very interesting to see that there was a tremendous increase of newborn service deliveries from 83% to 100%. You'll find that the project was really meeting its target at 100%. But also we had examined a number of indicators across the impact that was provided by providing health in these healthcare facilities. For example, running water was increased by 42% in this healthcare facility, from 80% to 100% by the end of the project. But hand washing with soaps, which is a critical kind of thing in most of healthcare facilities, was tremendously increased from 66% to 100% by the end of the project. So all the facilities that were intervened was provided with this hand washing facilities with soap. But also we have this waste recycling many waste dustbins, plastics, where you can keep your solid waste management, solid wastes, and the waste, other waste from the health facility. So the increase was that by the end of the project, we hit 100% that all the waste around the healthcare facility was able to be collected and safely disposed in these waste disposal facilities. So
thank you, engineer. Sorry, engineer. Thank you so much. I think we are getting very nice information from you, and without cutting you, because at some point we allow a little bit of interaction between ourselves and our audience. But I pick very key points. One of it being that there's serious interconnectedness between various SDGs, and we are clear that if you want to unlock the potential of achieving other SDGs, then you have to provide water, improved water and sanitation services. So engineer, just keep the points tight, because at some point we will get to a session where we want to give our audience a little bit more time to interact. Thank you. So if you allow me, I'll then move to the next panelist. The next panelist is Valentin Post. And Valentin, I just want to pose a question to you, which is, how is funding for WASH in low and middle income countries? That's the first one. So what is the landscape of funding for WASH in low and medium income countries? And what innovative financing model do exist to facilitate this, and especially looking into women? Valentin?
Thanks, Martin. So my surname being Post, I think the pun was intended. So you pose these questions to me. It's a pleasure to be there, and it's nice to be in such an excellent panel. And thanks for all the attendees. So yeah, coming to the first question, the funding for WASH. Now let's start from WASH being a human right, a public good. And then at the same time, we do all know, and we're all in this session, and we're all specialists, we do know it's underfunded. Underfunding being one thing, but it's also from a, let's say, political priority, it's not very high on the agenda. Not of people, but also of policymakers. And the changes one can see, if it comes higher on the agenda, both of policymakers and when funding is really coming in large numbers, is a so-called Swachh Bharat mission or Clean India mission in India until 2019, in which they construct up to 100 million sanitation systems in a relatively short period of 5 years. So with a political drive, maybe even more important than the money from many points of view. But for the people themselves, the money definitely was the key driver. So that's, yeah, it is underfunded. So you can see with political priority setting and putting in massive amounts of money that you can make a big change. Now, I know, you know, we all know that that money is not available. It simply is not there. It's not there with most of the governments in the countries we're working with, but even in many other countries, that sort of money simply is not there. We do see there is enough money, but it's somewhere else. It's by and large institutional money, it's commercial money, it's not money going for sanitation systems. So what sort of innovative financial models are we looking at? We're looking at models which can mobilize that sort of money which is there. So the money which we know is with banks, is with pension funds, is with insurance companies, can we somehow tweak and twist that and make them interested in the sanitation sector? I'm talking about sanitation, sorry, I don't know much about WASH, I'm a sanitation guy. So water, I'll leave it to others who know more about it. So what we have done over the last 10 years, we built about 1 million sanitation systems in a 200 million euro or dollar program. out of it, a large extent was commercially financed. So yes, it is possible to get it. And what is now the interesting part is what is getting financed is not the big businesses. It's by and large household sanitation. And what we do find is that it's running through mostly microfinance institutions, banks, SACCOs. And these, and I'm coming to the second part of Martin's question on the gender element. Microfinance, as you all may know, is by and large run by women. And the main clients are women for a number of reasons. I won't go into those at this stage. But what you do find is next to having a lot of benefits purely from the sanitation point of view, which already Hajra and Engineer Maturi pointed out, next to that, there's a lot of pride in the people. People are involved in organizing groups, in getting the women to talk to financial institutions. You see there's a lot of change in them. So they are looking different in the world. And that sort of social impact is something we're not capturing in our models, but we see it's massive. So there's a complete dynamic change in the country we work in. Then we also do see, it's a little bit more, I would say, anecdotal, but it's interesting enough, I think, to mention. Engineer Maturi also talked about women businesses. Hajra did the same thing. And since we're all working together, I also know about these things. But what is interesting, I found in one case in India with one of our microfinance partners, they were training women, masons. And I thought that's an odd thing. So why are they only doing women? And they had a selfish interest because they found that once they were training male masons or artisans, they tend to run away and move to the big cities. And they found that women were far more, I would say, staying in the areas because of various other social reasons. So they developed on their own a model running on women masons, which we thought was very interesting. The same we observed in the business of waste valorization, so mixing solid and fecal sludge, already mentioned. And lastly, I think that's something which we learned from Kenya, is that schools can also be financed quite innovatively. Quite often constituency development funds or local government funds or political funds can be used for school sanitation if you give them let's say, a good deal. And a good deal meaning that they get more sanitation for their money, that's one. And secondly, we do find that private financial institutions are also interested in supporting school sanitation because they also see a business in it. And we all know, and I think that's already been highlighted, that this is a major change or a major drive for social change. So I think, Martin, I've been talking a lot. Let me stop here.
Thank you so much, Valentin. But you mentioned very key points, including like, the political drive to mobilize public sector engagement in unlocking finances for financial inclusion in totality. So keep all the other points because I would want us to move quite fast so that we have time for our participants. And in this case, I want to invite Unia Musasi. Unia, I just want to pick your thoughts about what you think is the role of NGOs or CSOs towards providing equitable access to basic wash and SRS, sexual reproductive health services. So, Unia, the floor is yours.
Thank you, Martin. Good afternoon, good evening, good morning, members who are joining us online. What I want to talk about is a case of Uganda, where the Uganda Water and Sanitation Network, as Martin already mentioned, we have a membership of more than 200 civil society organizations that are specifically working within the water and sanitation sector, but just like other panelists have shared, linking this to sexual reproductive health and hence empowering women. And annually, as a commitment to fulfilling the mutual accountability and promoting transparency and accountability in the sector, the USNet, we always compile an annual assessment of the performance of all the civil society organizations within the water and sanitation and hygiene sector. And our annual assessment has come to reveal that the joint efforts of the civil society organizations, those that are able to report through us, at least we contribute funding that is almost equivalent to the grants that government gives to local governments to implement water and sanitation services. So that is the importance. When you come together, when you combine the efforts of civil society organizations within our sector, it's almost equivalent to what government does on the ground within the local governments. So specifically the key roles that civil society plays are service delivery, like Amref has shared the different case studies, but also many other organizations that make up the networks within the different countries contribute to service delivery, both availing water closer to the communities, addressing issues of sanitation and hygiene, washing schools, in healthcare facilities, and also coming up with initiatives to specifically empower women, much as these services are provided. For instance, many organizations, they try to bring together women and promote savings through circles, which help to improve on their economic empowerment at household level. The second role that civil society plays is the role of research and development. And it's through this research that we as civil society generate evidence that we then use for another role, which is to advocate so the sector and all the different practitioners can address key sector challenges. For instance, last year, in partnership with Twaweza, USNet partnered with Twaweza to assess and advocate for equitable distribution of water and sanitation services in Uganda. And through this research and the evidence that we generated, we were able to convince government, which is now at the process of undertaking a national assessment of what are the factors leading to inequitable distribution of water and sanitation services within the country. And from that revelation, the emphasis was that the research revealed that at least 4 out of 10 households, the burden of fetching water at household level is on women. So you can see how we relate much of the work that we do to women empowerment at different levels. The other thing is that NGOs are good at doing is coming up with innovations. This afternoon, you've been sharing different case studies of the innovations that you've been able to come up with. But also in Uganda, for instance, we have a challenge which is quite similar to other African countries of sustainability. We are still faced with a challenge of not having universal access. Then the few resources that are there, almost 20% of them are not functional. This is year after year. So different organizations like Water Mission, like IRC, like JESE, have come up with technology that is trying to address this, so that technology that's promoting pay as you fetch, so that that money which is generated there and then can address the issue of sustainability. Then, of course, other approaches, for instance, for sanitation, you've been sharing sanitation as a business, which is both addressing issues of promoting hygiene and sanitation, but also empowering the communities that are involved in this. One key role that I want to mention, that many NGOs, and I'm one of the key promoters, because as NGOs, you find that very few of the NGOs can really, NGOs have minimal funding. So that minimal funding, in spite of having good programs or projects on the ground, they can't scale them, on a wider scale. So what we are calling for, and what many other stakeholders like development partners, even government itself, is for us to fulfill our role of being a watch. If you are in a community, you can easily bridge that gap, that knowledge gap of assessing where there isn't equitable distribution of wash services, where those that are put in place, are they sustainable? Are they really addressing, and also the hard to reach, are they really accessing these services? So we need to beef up our role of being watchdogs, because in countries like Uganda, we're lucky that civil society organizations were given the space to engage with key decision makers, right from local governments up to national level, where we're given the space during the joint sector reviews, at the sector working group meetings, for us to table what are the key challenges within the sector. Then lastly, we have a key role.
Yeah, sorry, Unia, you could summarize so that we afford time for our audience. Please summarize.
Yeah, this is my last point. The role of contributing to policy development and dissemination. For instance, currently, Water Aid is supporting, based on the evidence that they generated through research of washing healthcare facilities being marginalized. They're currently supporting, in partnership with UNICEF, government to develop national guidelines that can promote washing healthcare facilities. So in brief, those are the key points of the role of civil society organizations in addressing WASH.
Well, thank you so much, Unia. Keep all the points because I want us to interact very strongly with our audience. But one of the key things which you mentioned is that if we combine the effort of CSOs, NGOs together with that of the government, I think what we are saying is that there's no major challenge that we will not be able to surmount. Now, that said, I want to attract the attention of Dr. Halid. Dr. Halid, I just want to ask you a very brief question. How can we foster multi-sectoral partnership, championship, and leadership that then spurs coordination and facilitates accountability in WASH and with the lens of women empowerment? Dr. Halid?
Thank you very much, Martin. Good afternoon, good evening everywhere. First of all, I'm really delighted and feel honored as a man to be one of the panelists in this very important discussion around women empowerment. I would like to commend the wonderful contributions from my fellow panelists. I would also like to join all, particularly women across WASH sector. I've been asked to share some considerations around the multi-sectoral partnership, health leadership, coordination, accountability on WASH and women empowerment. All these topics are very important, and actually they are very rich in discussion. And I wish we had more time to part. In view of the Sustainable Development Goals, especially if you look at goal number 17, it identifies multi-stakeholder partnership as important vehicles for mobilizing and sharing knowledge, sharing expertise, sharing technologies, and sharing financial resources to support the achievement of the goals in all countries, particularly developing countries. The goals seek to encourage and promote effective public, private, and society partnership, and they provide the resources to support strategies of partnership. It is obvious that we can't solve the WASH challenges effectively if our nations don't prioritize the multi-sector partnership in the sector. And this should start from the design stage, through implementation to monitoring and eventually evaluation. Participation of all key sectors in WASH is key to make sure water, sanitation, and hygiene service. And in most cases here, we're talking about women and children. Likewise, in promoting this partnership, the global community really need to ensure that the policies provide equitable room for women participation and involvement. We really need to advocate for policies that stimulate women's participation on WASH. And if I can cite an example in Tanzania here, where inclusion of women into community-based water supply organization is mandatory. And this is a good example of engaging women in taking leadership in WASH activities. In these organizations, women not only participate, but also take position in the governance. On the part of sanitation and hygiene activities, inclusion of women, community health workers, or volunteers is mandatory, is a must. Actually, we have set a criteria of including women into community monitoring teams. And I can tell you, over 50% of the team composition are women. The issue of coordination and accountability are also important pillars in ensuring WASH services are adequately delivered. Partners in the sector need to be well coordinated to ensure there is no duplication of efforts and the plans in the country are transparent. On the other hand, accountability is an important pillar in the effective delivery of services to the public, including women who suffer the most. For example, in situations where there is a critical shortage of water, or there is inadequate sanitation and poor hygiene practice, or sometimes both. It is therefore very important to bring on board women in monitoring of WASH intervention right from the beginning. To conclude my contribution to the topic, I would personally like to see women, our mothers, our sisters, taking a leading role in WASH sector because they are the most vulnerable. Let us together, while we are celebrating Women's Day, reflect the great contribution exercised by women in WASH services every day. Therefore, giving women more responsibilities in WASH is potential for sustainability because they will definitely treat every matter responsibly. I'm afraid we don't have much time to continue, but there are studies that have found that more substantial improvement in the governance, transparency, and sustainability of water supplies are achieved when men and women are involved equally than when women are involved only marginally or not at all. In Tanzania, gender equality and women empowerment are well documented in our national constitution. I would therefore urge at level to ensure women are empowered and fully engaged in managing WASH both at the government level and in direct management of the services. After all, as it has been said, water, sanitation, and hygiene is a business, but I'll say is a woman business. Thank you very much for your attention.
Thank you, Dr. Arind. I think you put it very clear, and there are some very key points which I picked, and you said very clearly that we can't solve the WASH challenges without multi-sectoral collaboration. And you also saying that there is no men without women. So those are very key highlights. And as I said, I want everyone to keep it close. And just in case you find time, there are many questions which our audience is posting to us. Kindly go to the chat. If you can be able to respond very quickly, do that per question, because at the end of the day, we want to pick just one, two to just respond to. Now, I go to Professor Miriam. Professor Miriam, you've been our mentor in the area of public health. And I just want to pose to you the question, what is the current situation of WASH and women empowerment in the lenses of sexual and reproductive health? from the group perspective? And how can we then amalgamate all these to achieve universal health coverage? Over to you, Professor.
Thank you so much, Martin. I'm delighted to be here and honored to be here. I am learning every day from all of you, practitioners, and actually making things happen. I think it is absolutely fantastic to come after Dr. Khalid Massa and his last sentence, which is actually around Dr. Arif, around WASH is a business and it's a woman's business. And I think that fits perfectly with my background, having practiced WASH from the private sector for the last 15 years, and actually sold probably more bars of soap that there is to sell in order to get more people to wash hands. So I think to go back to what a lot of my colleagues have said and illustrated with already amazing stories from Ajra to Valentin to Engineer Mturi. You start very much with the fact that women and girls are empowered when they have control over the resources to meet their WASH needs and participate in the provision of WASH services. And we've heard that. We've heard that from Valentin Post whenever he was talking about women being trained as masons, being there and actually developing some of the water points, finding ways to be able to be involved in there. I think water and sanitation are fundamental rights and they're integral to a human rights-based approach to development. So we've known that for a while. And for me, this is the foundation to social justice anyway. So just wanted to reiterate that and take a few of these learnings that I've had in my, my 20 years in WASH, but in 15 of those having done it in the private sector. Going back to a few other points that have already been raised by my colleagues, WASH is a pillar of public health. So you're not going to be able to talk about, sexual reproductive health. You're not going to be able to talk about women and girls empowerment without addressing, public health. It's the key to the development. It's absolutely critical when it comes to achieving positive maternal and child health outcomes. It's key to alleviating the burden of disease, reducing death in healthcare facilities, and obviously contributing to a productive WASH force. Another point that's come up very clearly is how exactly can you contribute to reducing sexual and gender-based violence? And I think we go to, the daily task of collecting water, for example, the lack of adequate and gender-sensitive sanitation services that puts women at risk of harassment or sexual gender-based violence. Ajra talked about, she talked about 28%, I picked up this from her, up to 28% of girls losing a week due to menstrual hygiene and poverty, period poverty. And I think, and the fact that so many rapes are actually linked to women having to travel such long distances for water, using shared toilets, not having a girls and boys toilet, and having no alternatives to practicing open defecation. And here we're progressing even further, thinking about the intersectionality that exists when you're thinking already about, where do, girls and boys and teachers and students not having to necessarily share the same sort of toilets. I think there is something also that's very strong around the level of malnutrition that is linked to WASH that actually is at the bottom of what it will take to drive empowerment. Because what we've actually seen is that over 50% of all childhood malnutrition is linked to diarrhea, worm-related infections, and poor WASH conditions. So you need to think about it from a holistic approach, and it isn't WASH isolated. And if you don't have appropriate nutrition, how can you really think about women, girls being able to develop themselves to where they need to be? So to where they need to be. I think investments in WASH, also reducing the burden of unpaid work for women and girls, and facilitating participation in their education, in employment, in even leisure activities. Being able to practice through play is absolutely critical in terms of decision making. So if you think about it, and this is a data from WaterAid, I'm thinking about the fact that women and girls in Africa carry water containers on their head, hips and backs for an average of 5 kilometers each day, spending 40 billion hours per year on water collection. Just imagine what that means when you're talking about women and girls empowerment, and what does that mean in terms of reducing our sexual and reproductive health, for example. So, of course, I'm not gonna stress again about education, but you can't talk about sexual reproductive health without thinking about girls' education. And the fact that without appropriate water sanitation facilities, the time lost that girls are losing in terms of period poverty, The fact that young girls are actually getting pregnant because they are, they're trading sex for pads. We've seen that in Kenya, the high level of teenage pregnancies, for example. All this is absolutely critical. Another point that has been brought forward by my colleagues before is the economic opportunity that women actually get from entering in the water and sanitation services. And how can we get that into a way that allows these women to create more micro enterprises, and which is the bedrock of women empowerment. So how do you make sure that they can see local entrepreneurial opportunities and find ways to talk about WASH related income? And finally, the way you work with national and global government, to really meet the needs of women and girls. So how do you make sure that you are thinking about what their needs are at the table when they're sitting and having this conversation, when we're delivering and when we're thinking about solutions for them? And I think that is where it becomes absolutely critical. And it's always very important to remember what we're talking about and the importance of it when we're dealing with humanitarian and fragile context. And to end where Dr. Khalid has talked about, what is the role of the private sectors and brands, commercial brands that are selling soap, that are providing water, that are really thinking in terms of accelerating this WASH agenda? What can we do so that these multi-sectoral collaborations are ones where the private sector also has a seat at the table? Because I don't think this is an issue we're going to be able to raise just, obviously from with the public sector. We need thought leaders across all sectors. I know we're running out of time, so I want to make sure that we leave some time for questions as well. So these were some of the points I wanted to raise.
Thank you so much, Prof. I think that was so inspiring, and you were able to actually capture the entire session. And so now, looking at the hour, I just want to invite a little bit of answering of the questions that our audience have posed. And I'll do this by inviting each of us, the panelists, to pick just one question which was directed to you and answer it in 30 seconds and use the same time to conclude on what you would want us to carry home. So if you allow me again, I will start with Hanjra. Hanjra, you are there. I'm sure you've been interacting with the audience. So just pick one question and then conclude. 30 seconds, please. Hanjra.
Thank you, Martin, and thank you, participants, for raising the questions. I'll pick the question of strategies that can work to bring on board the people that normally go through the cracks of development. And I'll cite the strategy of clustering communities to ride on each other's social capacities as an effort of self-help initiative that works very well for us under the Finnish Mondial initiative, where people have to pay for sanitation. And in closing, everyone is alluding to how women have to fetch water. I want to tell everyone that women's heads were not designed for carrying water. We have very beautiful brains. We could be the best managers, the best pilots out there. Please bring water closer to women so that we can use our heads to better manage this world.
Yep.
Excellent. Thank you. Thank you so much, Hanjra. And now over to you, Engineer Mutuli.
Thank you, Martin. I don't see a specific question, but I can pick this one from, it is not written the name, but it comes from one of the mobile number. It says that what is the most challenging and ignored component of WASH in Africa? I will try to respond on this, but I know you can also add on this. I think the most challenging and ignored component of WASH in Africa is the part of sanitation. When you talk of water, sanitation, and hygiene. Sanitation and hygiene is the most ignored, and that should be more focused in Africa. We know that sanitation has very limited investment to do with it, but the impact is quite huge. We have seen how the budget, our country budget, our resources has been allocated. very little to sanitation and hygiene. We have also seen that how the partnership and the stakeholder collaborations has been more screwed to the water more than the sanitation part. But also we have seen and we have heard from the presentation how potential the sanitation part has in the development careers in our government and in our community. So I think we need to focus more on the sanitation to unpack the potentials that brought by sanitations, but also the impact of doing the hygiene part, because by doing very little on hygiene, you bring a lot of impact, including the prevention of diseases.
Thank you, thank you. Thank you so much, engineer. And I see now our time is up. Colleagues, friends, our dear participants, I want to sum it up by inviting you to the plenary session. And what I want to promise you is that we'll be available. At the end, we are going to share email addresses so that we continue interacting, forming the movement which is going to enable Africa to move out of these challenges. I want to thank all of you, thank the panelists, and as we come to the end of this, I know the journey is tough, it is tight, but we are up to it. So thank you so much, inviting you to join us in the plenary session. For now, I want to say bye-bye, see you, and thank you so much. Kwaheri. Thank you, bye-bye. Engineer. Engineer.
Hello, Martin.
Yeah, sorry, I can see still we are not around. So we shouldn't be joining the other session.
Yeah.
But this was, thank you so much. I think
Martin,
this.
thanks,
Yes,
thanks for discussion on Renatus. What should we do with it on the interest rates? I was about to type it, but I think I'm be kicked out of this session, right?
Exactly, it's kicking out very shortly. So that's the reason why I decided to just summarize and allow other people to join the other session. So I think it's a good thing that you're asking. What we'll do is I'll request for backend kind of information that then we can be able to share the information back to our participants. That will, yeah.
Yeah, exactly. Yeah.
Thank
Okay,
you,
so
Martin.
I'll stop typing, right?
Yes, exactly.
Okay. All right.
Thank you so much.
Okay, thanks.
Thank you
everyone.
Thanks, Frida, for organizing.
Bye.
Thank you very much.
Bye.
Bye.
Bye. It was really nice.
Yeah, sure. Dr. Frida, we never ended before it was, right?
Yeah.
It's 5:20. We were ending at 5:20, right?
Yeah, 5:20, yes.
Yeah, I'm sorry, I'm normally so strict on time, eh?
But you did moderate very well. Thank you very much.
Thank you. You are there for me too. Thank you so much.
Thank you very much.
Martin. You did a great job.
Bye. Okay, thank you. Bye.
Bye.
Bye.